Victoria, Derbyshire, and we're live from New Broadcasting House. Widespread transmission of coronavirus in the UK is now highly likely, according to the Chief of Public Health England.
So I think the increase in numbers that we are seeing, coupled with the increases in countries nearby in Europe and of course in Southeast Asia, do make it much more likely that we will get more widespread transmission in the UK.
Meanwhile, the first emergency meeting chaired by the PM to discuss how to fight coronavirus will start in half an hour. He says the government will stop at nothing to contain the outbreak, so what will that mean for your daily life? Also, this woman is taking an NHS gender identity clinic to court because she says they didn't sufficiently question her decision to transition to become a man when she was 16.
I should have been challenged on the proposals or the claims that I was making for myself, and I think that would have made a big difference as well.
We'll speak live to the director of the clinic, the Tavistock, who says they do robustly challenge every patient about their desire to change gender. And you're looking for a surrogate to carry your baby. Your long-lost cousin reads about your search and steps forward to help. That's what Ellie did for her cousin Olivia. Ellie is now 20 weeks pregnant, although you can't see in that shot. I promise you, she's 20 weeks pregnant with Olivia's baby. We will talk to them before 11. Hello, good morning, welcome to the programme. We're live until 11 as we are each weekday. Really want to hear from you this morning. Have you made any changes to your routine, either at home or at work, as a result of coronavirus? Are you clear about what the advice is, whether it's washing your hands, shaking hands, self-isolating? Do let me know this morning if you've made any particular changes to your own routine. I have been encouraging my teenage boys to really properly actually wash their hands when they've been to the loo, because as you know, teenage boys don't really like to do that. That's the kind of thing that I'm doing in my home. What about yours? Send me an email, victoria@bbc.co.uk, text 61124, or you can message us on Twitter, use the hashtag VictoriaLive. Let's bring you the news so far today. It's Carrie.
Thanks, Victoria. The Prime Minister will chair a meeting this morning of the government's Cobra Emergency Committee to approve new measures to fight the coronavirus outbreak. The number of confirmed cases in the UK jumped yesterday to 36. Including a health worker at the Mount Vernon Cancer Centre in Hertfordshire. Labour, meanwhile, has accused Mr Johnson of being a part-time Prime Minister for not holding an emergency meeting sooner. The number of deaths globally in the coronavirus outbreak is now more than 3,000. Most are in China, which reported another 42 fatalities, all in Hubei province, where the disease first emerged. The leader of a religious sect in South Korea has publicly apologised that so many of its members became infected. The Shincheonji group has been linked to about half of the country's more than 4,000 cases. Other news: in the first round of trade talks between the UK and the European Union start today. A team of 100 negotiators, led by the Prime Minister's Europe advisor, David Frost, is travelling to Brussels for an initial 4 days of talks. It's expected that cooperation on security and transport will also be discussed. One of the candidates once thought to be a frontrunner to contest Donald Trump in the upcoming US presidential elections has announced he's to end his bid for the Democratic nomination. The former mayor from Indiana, Pete Buttigieg, was the first openly gay candidate to run a major presidential campaign, but after a promising start, his support has waned in recent weeks. Here, a new minimum alcohol price comes into effect in Wales today. By law, retailers and any other outlets serving alcohol must now charge at least 50 pence per unit. The change follows a similar move in Scotland in 2018. New research suggests teachers need to be paid more if the acute staff shortage in schools in England is to be addressed. Figures from the Education Policy Institute say more than a quarter of all schools have vacancies or positions filled by temporary staff. The government says it's delivering programmes to support and attract teachers. ITV has apologised for any offence caused during a performance by Anne-Marie at the end of Anton Deck's Saturday Night Takeaway. The show's hosts wore headbands that featured the Japanese rising sun flag during a martial arts-inspired performance of Ciao Adios. The flag seen by some as a symbol of Japan's imperial past. Scientists believe they've discovered the reason why dogs have such cold, wet noses. It's so they can function as heat detectors, apparently. A study published in the scientific report Journaling says the tip of a dog's snout can detect the warmth of a small mammal from around 5 feet away, but it must be kept cool to work properly. So there you go, Victoria, now you know. Back to you in the rest of the programme.
Thank you very much, Carrie. Thank you. Thanks for your messages on how you are changing your routine, your plans as a result of coronavirus. I'm going to read some in a moment. Widespread transmission of coronavirus in the UK is now highly likely. That's according to the Chief of Public Health England. In the next half hour, the PM, Boris Johnson, will chair a meeting of the government's COBRA Emergency Committee to approve new measures to tackle coronavirus in the UK, as the number of confirmed cases in the UK has risen to 36. That is still a tiny number. The latest cases included 12 more in England, and the first patient in Scotland, meaning the virus has now reached all 4 nations of the UK. One of the new cases is a health worker from the Mount Vernon Cancer Centre in northwest London. The number of people killed worldwide by the coronavirus has exceeded 3,000, most of those in the Chinese province of Hubei, where it emerged late last year. There have also been deaths in 10 other countries, including more than 50 in Iran and more than 30 in Italy. Worldwide, there have been almost 90,000 confirmed cases, with the numbers outside China growing faster than inside. The World Health Organization has said most patients have only mild symptoms. Senior ministers and health advisors will be told at this morning's COBRA meeting that containing the virus here will present a significant challenge. We brought in some experts of our own this morning, and we definitely want to hear from you in terms of if and how you are changing your own domestic routine. This is Dr. Bharat Pankania. He's an expert in communicable diseases at the University of Exeter. Saffron Cordery is the Deputy Chief Executive of NHS Providers. David Heyman was Exec Director of the World Health Organization Communicable Diseases Cluster, during which he headed the global response to SARS. Also here is Labour's John Ashworth. He's the Shadow Health Secretary. Welcome all of you. Thank you so much for coming on the programme. So first of all then, let me ask you, John Ashworth, how you think the government is handling this?
Well, as it happens, we've been broadly supportive of the government's attempts to contain the virus and delay the spread of the virus. I mean, we were a little bit disappointed that Boris Johnson went on the TV on Friday and said, "Oh, we really need a COBRA meeting," but hasn't arranged a COBRA meeting until today. But nonetheless, we're broadly supportive. However, given this is now becoming more serious, I think there are deep concerns about has the NHS got enough resources to cope? We know it's suffered from 10 years of austerity, and we know how many beds have been cut. But also, more generally, I think the government needs to step in and do something for low-paid workers, those who are not eligible for statutory sick pay, those who are on 0 hours contracts. Because if more and more people are getting the virus and being asked to self-isolate, I don't want low-paid workers to be forced to make a choice between their own health or hardship.
Is all that necessary? In this country, we have 36 confirmed cases. It's a tiny number.
Well, you're right. We shouldn't get hysterical about this, but we shouldn't underestimate how serious this is, because it is very infectious. It seems to be spreading very quickly, and all the medical experts, all the scientific experts are saying we're going to get more cases, and it looks like it's heading for a pandemic. It's not been defined yet as a pandemic by the World Health Organization, but there are lots of scientific experts who are saying that's where this is heading.
Let me bring in Saffron Cordery, Deputy Chief Executive of NHS Providers. I'm going to read you this email from a junior doctor who's just got in touch with me. Doesn't leave their name. I'm a junior doctor in London. Every day I commute through London, including one of London's biggest train terminals. I come into close contact with hundreds of people each morning, and then I walk straight into hospital for work. My colleagues do the same all over London every day. How do we really think we can sustain a workforce if we're made to self-isolate? Who will work in the hospitals? Finally, is it safe for doctors to blindly begin their days on the wards with close contact with all patients with multiple comorbidities? By the time we know a doctor might be infected, it will be far, far too late. I personally cannot believe we're continuing like this. How do you respond to that?
So we know that it's really challenging at the moment to work out what the right balance is between saying to people, okay, all bets are off, we've got to kind of close down people working and that kind of thing, versus actually continuing to administer healthcare. So I think we have measures in place. So the hand washing that you mentioned at the top of the programme is really, really important, and doctors do know that. Basic hygiene on those factors is really important. So I think what we've got to be clear about is that this will take additional resources in terms of staff, in terms of money, in order.
Where are you going to find extra NHS staff?
So
in short term?
It's very challenging, and we will need to prioritise clearly to work out what we need to do and what we don't need to do should this become even more serious as time goes on, and the indications are that it may well do.
Okay.
I think what we've got to be clear about is that we are putting in place those measures that are helping us to test people, to get the results, and to get people to follow the very simple advice, which is basically wash your hands and self-isolate.
Steve tweets, my wife and I have this morning cancelled our ferry trip to Spain. We were due to travel on the 9th on a 2-night trip to Santander from Portsmouth. The increase in infections overnight and the Public Health England statement this morning has been pivotal in our decision. We will stay diligent. Sean says, I'm not changing anything. I just hope it goes away. I'm worried it's going to ruin the summer, though, in terms of concerts in Euro 2020. John says, I decided yesterday not to take my grandson swimming because I could find no reassuring government advice on attending public swimming pools. And so it goes on. If you were in that COBRA meeting this morning, Dr. Pankania, what advice would you be giving the Prime Minister?
What we need to do is get a measure of this, and the measure is this. This is an infection from a new virus that has just emerged, and it is infecting people. It is more infectious than the influenza virus, the seasonal influenza virus. So what we need to do is lower the rising tide. That is the important message.
Contain it.
Contain it. We have to. And the reason why we want to contain it is to reduce the number of new cases. If you have a smaller number of cases, then fewer numbers will need to go to hospital, and fewer numbers will need to be treated in intensive care units and such places. So priority number one is do all you can to reduce the rising tide of cases. We want to keep the number of cases as low as possible.
Okay. David Heyman, how do you contain this coronavirus?
Well, containment is what the United Kingdom knows very well how to do. They've done it when MERS coronavirus came into the country 2 times, and they've done it again at the beginning of this outbreak. What's necessary now is just to keep up the efforts to make sure that when cases occur, a containment activity is conducted, which means finding contacts, making sure that they self-isolate, and that if they do develop signs and symptoms, they report immediately to 111 or the number that they're told to report to, and find out what to do next. But self-isolation is very important. And I heard that people are beginning to think about whether or not they should cancel their trips. That's very healthy, because people should take this as their own and make their own decisions based on what they know. This is what's happening in other countries in Europe and around the world.
Well, in France, I mean, let me come back to our guests in the studio. In France, for example, the advice is not to shake hands, which I'm certainly still doing. Some indoor events have been cancelled. There is no kissing on the cheeks. The staff at the Louvre have asked that bosses close down the Louvre. I mean, we're not doing any of that here, John Ashworth. Do you think we should be?
Look, we should just follow the advice of the Chief Medical Officer, and if the Chief Medical Officer and all the scientists and the clinical experts suggest we need to take more drastic action, then we would support the government in taking that action. I think that's the responsible position for an opposition party. But the government do need to sort of step in and make sure the NHS has got the resources, but also deal with some of the bureaucratic things which will hinder this self-isolation. Let me just give you one quick example.
Yeah.
We're telling workers they have to self-isolate and quarantine themselves. Well, to do that, they need to go on sick pay. To go on sick pay, they need to get a note from their GP. But they're also told, whatever you do, don't go and see a GP. So things like that, which are still happening, need to be resolved.
Okay, how do we avoid getting it?
Well, it is droplet spread, right? So our current knowledge tells us droplet spread. And as far as our knowledge goes, so what we do is we maintain good hygiene, because you don't want to do this and introduce the infection to yourselves. So maintain good hygiene, wash your hands and soap and water, and then dry your hands. So it's clean, dry hands that are very important. On top of that, when you cannot wash your hands, it's alcohol hand rub. But alcohol hand rub, or gel as it's called, is not the panacea. It is an alternative to when you cannot have otherwise clean hands. And then one more thing is, you need to make it make it a conscious effort. People unconsciously cough and sneeze. You need to bring that into your conscious. So I'm going to sneeze. What am I going to do? You pull out a tissue paper, you catch it in your tissue paper. That tissue paper is now contaminated. You get rid of it, and now your hand is contaminated. So you wash it with warm water and soap.
And if you haven't got a tissue, just do it in your elbow.
Indeed.
Okay. Who is vulnerable to getting it?
Well, this is a new virus, and because it is a new virus, everyone and anyone can get infected because you don't have immunity to it. Having said that, the data that we've got from China and other parts of the world now is it seems to affect the elderly more so, and elderly with other coexisting conditions.
Okay. The deaths from coronavirus at the moment are around 3,000. Between 300,000 and 650,000 people die globally from seasonal flu. And broadly speaking, we seem to take that in our stride. Are we overreacting?
No, we're not overreacting. This is really important. This is a new virus. We don't know what it's going to do. We don't know how many people it will make ill and how many it will take.
And we don't have a vaccine.
And we don't have a vaccine, and we don't have any medication. And flu is preventable with the seasonal influenza vaccine. We've got to do everything we can to remove this virus from circulation, like we successfully did with the 2002-2003 SARS virus. It is not in existence anymore. So we need to do that again with the COVID-19 virus.
Do you think, Saffron Caudry, that the NHS will be able to cope should the numbers of those infected continue to rise?
I think that the NHS is in a good position to cope. It copes locally when issues occur, and scaling up that response, I think it is in a good position. As John said, there are some real issues about resources, but I think we are in a place, the plans are there. And I think what we have got to think about, though, is the wider perspective. So, this will start to affect NHS staff. When schools close, what does that mean for staff who may have to look after children? We need to think about the wider ramifications. Social care staff, if they start to be affected, caring for people in their homes, there are big issues there. But I would say that the plans are firmly in place. The testing plans are in place. We have, the protocols there.
Okay. David Heyman, I'm just going to read you a couple more messages from our audience this morning. These are people who are potentially changing their routines, and I just wonder what you think of this. Maisha has emailed, we were planning to go to Malta for my daughter's 13th birthday in the first week of April. We all have asthma, and my elderly mum was accompanying us. We've just cancelled our plans and lost half the money, but we just can't take the risk because we don't know what the situation would be like in a month's time. I'm 2 years, says Martin, I'm 2 years post-stem cell transplant and on thyroid medication, which lowers my immune system. What am I supposed to do? Hide inside? I have to work and I have to be a dad. So I'm going to have to take my chances, I guess. How do you respond to those two, David?
Well, what we're hearing is that people do understand the disease, do understand how it's transmitted, and are taking precautionary risks for themselves. That's what people all over the world are beginning to do as well. Understand the issues and take the precautions that people feel are necessary to protect themselves. The reason that containment activities and control activities in Singapore have been so effective is because people have taken this as an issue for themselves, not only to protect themselves, but to protect others. And so I think this is what's penetrating the minds of many people throughout the world, including in the UK. And it's very healthy that people do take charge of their own issues based on what government guidance is.
Sure. Thank you all. Really appreciate your time. Thank you very much. A couple more messages. Glynis says, my husband's currently undergoing chemo. Is due to start his last round this week. It was cancelled from last week because his blood count was too low. He's already been hospitalised with sepsis a few weeks ago. It's a very frightening time for us. We are always very careful about going out and about, but now it's a nightmare. This texter says, my husband and I decided yesterday to start stockpiling some tinned foods, milks, frozen foods, just in case of any future self-isolation requirements. We're listening to the scientists on TV and radio and are planning to take further measures this week if necessary. And for me, I chose not to take communion at my church yesterday, despite the vicar's assurances. So it is affecting all sorts of areas of people's lives. Thank you very much, all of you. Thank you. Do keep your messages coming in. Are you changing your routine, whether it's at home or at work? Let me know. Victoria@bbc.co.uk. Still to come before 11, this 23-year-old woman